All right. Well, good afternoon, everyone. I hope that you all were able to find your lunch and get some food in your belly because we are getting ready to get started with our afternoon session. There is a quick announcement. The ladies' room past the elevators, they will begin working on that shortly. So if you need to use the ladies' room, we do have restrooms back here behind the stage. You can just walk along this wall and follow the signage. So again, they'll be working on the restrooms to the past the elevators, but if you need to go right back here, just follow the signage. Well, we want to thank you all for making it back on time because we have an incredible keynote speaker who will be coming up, Dr. Miriam Delphin-Rittman, who is the Assistant Secretary for Substance Abuse and Mental Health. She previously served as the Commissioner of the Connecticut Department of Mental Health and Addiction Services and served in this role for 6 years. Prior positions held at DMHAS include Deputy Commissioner, Senior Policy Advisor, and Director of the Department's Office of Multicultural Healthcare Equity. In her role as Commissioner, Dr. Delphin-Rittman was committed to promoting recovery-oriented, integrated, and culturally responsive services and systems that foster dignity, respect, and meaningful inclusion. Please join me in welcoming Dr. Delphin-Rittman.
Good afternoon, everyone. I have to say, it has been just such a pleasure to be here and to see so many familiar faces and friends. And I know we have many members and delegates from the SAMHSA TTAC here, from our STAC, I believe from the DTAC and the VA TAC as well. And just what a wonderful community and morning that we've had already. So such a pleasure to be able to add to the discussion. Oh, I have the clicker. Let me see. So what we're going to do, so real quickly, we have about an hour, but I'm going to try to be disciplined and go through my slides in maybe like 30 minutes or so, and then really want to have discussion. I figure we have such a diverse group, and so would love to hear from you all, and happy to take questions and discussion, and so we will definitely have time to do that. One thing that I'd also like to do, in addition to having discussion, some of the areas I'll talk about during my time is we'll talk about just some of our work at SAMHSA, where we have been able to support traditional healing and cultural practices. It has been a real priority and just an exciting area for us to be able to work collaboratively with many of our TTAC members and STAC members and others in terms of really getting ideas around how we can do this meaningfully. How can we meaningfully create opportunities across the work at SAMHSA? And so that's really what I'm going to talk about, how across the work at SAMHSA we've opened up a sort of ideas and activities and ways to be able to incorporate cultural practices and traditions into our grants, into our training and technical assistance as we're thinking about policy or even some of the resources. So we'll talk about some of that. I'll share some amazing examples. I think in my role, I've been in this role for just under 4 years now. And I think one of the favorite parts of my work has been really going to Indian country and meeting with tribal members and leaders and others who are doing really creative, innovative work, implementing programs that are meeting communities where they're at and addressing mental health challenges, substance use challenges, thinking about prevention. And I'll say a theme throughout that, and you'll hear a theme in my presentation is that, culture is healing. And we heard that over and over. And certainly one of the things I appreciated in the various meetings and visits, that culture is healing. And traditional practices, that is prevention. And so certainly in my role, it made sense for me that we find ways and we really work at that we grapple with it together. On how to meaningfully create opportunities to incorporate cultural practices within our notice of funding opportunities, within our grant programs. And so I'll share some of that work that's happening and that some of our grantees are doing. And it's always such an opportunity and a gift to be able to witness and visit some of those programs. And as I mentioned, then we'll have time for questions and discussion as well at the end. I'll try to leave at least 20 minutes for that. So one thing I wanted to start with is, at SAMHSA, we are truly committed. We are truly committed to the work of, for one, honoring, the government-to-government relationship and really recognizing that, honoring that, continuing to show up and to work together on how we can work to incorporate meaningful practices and truly meet the needs of tribal communities. We're committed to looking at our resources and, as I mentioned, finding ways to develop practices or grant programs or resources where tribal nations, communities, organizations can incorporate cultural practices. We also so honor the Cultural Wisdom Declaration and the Tribal Behavioral Health Agenda. I'll talk a little bit about those, but we really see those as central and guiding pieces of our work. We know that the TBHA was developed collaboratively with tribal members, our TTAC. I'm so grateful for their work, and I know many members of the TTAC are watching or have joined virtually. But we have been so grateful for that support that we received from TPAC members and others. In fact, I'm going to go back a slide because I remembered I wanted to comment on. So that top picture that's from our last meeting with the TTAC. We met in Washington State, and it's just such a great group that's been together quite a while, and so we're able to have those important and difficult conversations, but also able to be together for 2 days, and in addition to the meeting, do some community visits to better understand sort of what this work and what the challenges and needs are at the ground. And then the other second picture, we think it's so important to connect with young people, and so that's another group that I just want to lift up. We did a youth tribal summit, and there are young people who came from all over the country, and we see between the TTAC and the young folks, so grateful for their guidance and wisdom and what they've shared as we're thinking about our work and how to make a meaningful difference and impact. So did want to sort of go back. I meant to note those two pictures. So, in terms of the Cultural Wisdom Declaration, the other thing that we think is so important is to really uphold and to honor those 6 principles, to work on trust, to be aware of the importance of being trustworthy. Part of building trust is being trustworthy, being consistent, treating individuals with dignity, respect, treating our meetings like that, coming to the table with these principles in mind. And so all of these areas we see as central, important parts of our work. So I'm going to talk now about sort of some of the specific ways in which we've worked to try to create space and opportunities for cultural practices and traditional medicine and beliefs to be incorporated into our grant programs, policies, all the areas that I'd mentioned. And so one is, one thing we did early on, and this is right after I started. Whenever we put out a grant, there's a whole bit of work that happens before, and when we're looking at, we call the NOFO, and deciding what the updated language is we want to have in our notice of funding opportunity. And so one thing we did early on is added in specific language around incorporating, often the language that was there before had content related to like evidence-based practices. And so that's important, but we also deliberately and consciously added language around incorporating traditional practices and traditional medicine and cultural practices and life ways, and to incorporate that into the grant as well. Because we heard loud and clear that culture is healing, and traditional practices, that is healing, that is prevention. And so, and as we heard about earlier, we said 30,000 years versus some of the evidence-based practices, like if we're lucky, a shorter period of time. So certainly it has been important for us to create space for both of those to be incorporated, but certainly the traditional practices as well. Another thing that we did was TOR. So TOR is our largest grant program, and I'm going to talk about these a little bit, but TOR, I'll get into more detail in terms of specific examples, but a message we heard loud and clear is that there is not enough time to implement TOR. It's only 2 years. And so what we heard is that in order to really implement a practice or a program, it has to be extended. 2 years is just not enough time. And that came through loud and clear and through tribal consultations and many other meetings. So we figured, what, that is something that we can do. So we just extended it to 5 years to be able to allow more time for a program to take or to be implemented or for hiring or for scaling up a traditional practice or program or traditional medicine. And so really pleased to be able to do that. The other thing we've done is, we have within our grants, we have 9 grants that have tribal set-asides. And so those are, the larger grant programs. And again, these are all put in place per Congress, part of our budget, per Congress. But we have set-asides within those specifically for tribal members and tribal communities. And then tribal communities are eligible about 88% of the grants. SAMHSA grants. Some of those ones where tribal communities are not eligible, it might be like it's a state block grant, but by and large, we certainly encourage and welcome ongoing applications from tribal members. And I'll soon be sharing some of the amazing work that's been happening that I've had the opportunity to go and see firsthand in terms of people really meeting communities where they're at. The next thing I wanted to share about is the tribal behavioral health agenda. And you heard me mention that before. This agenda was about 10 years old, so it was developed about 10 years ago. We see it as such an important blueprint for working with tribal communities and thinking about sort of programs or practices or even policies with tribal communities. And so one thing that came through in the early consultations about this with our TTAC and through the other consultations, that it's really important that this be updated, that it be updated and that we increase the accessibility of it, that not everybody necessarily has access to the printed copy. And is there a way that we can make it more accessible? And oh, by the way, it's important to update the data that's included within the tribal behavioral health agenda. And so we did that, and so grateful for the consultations that we were able to have and the feedback that we received there about the importance of doing that. We also created an online platform. That way it is available online through the phone, computer, however, but really just wanted to make it more easily accessible. And then it highlights, there's content in there, so a number of specific sections and examples. So do take a look at it that highlight strategies and specific approaches around incorporating indigenous healing practices and cultural practices and traditions in ways that are making a meaningful difference at the community level or the individual level or family level. So certainly do take a look at those. And an ongoing goal will be to have this continue to be, I would say, a living, breathing, changing document that is continually updated, again, through tribal consultation and input. I will say by training, I'm a clinical community psychologist. And then along with that, I come from a big family. There's about 3 brothers, 2 sisters, so 6 of us. So I love I think the sort of magic or the sausage making happens through that important collaboration, that important space of sort of having connection and collaboration and conversation and back and forth. And so that's something that we'll continue to be part of the process of this tribal behavioral health agenda, updating it in an ongoing way through that conversation and collaboration and input that we'll continue to seek from tribal communities and tribal leaders and young people as well. Next thing I wanted to share about, and again, these earlier slides are, I'm sort of laying the groundwork for some of the ways in which we're, creating spaces, whether it's through our grant programs, our training and technical assistance, our different policies for, bringing in cultural practices and traditions and traditional medicine, that we welcome this and recognize that it's an important part of the health and healing process. One thing we realize is that, providers may need additional support or assistance or training or technical assistance. And so we were able to, this past year, establish the first ever American Indian Alaska Native Behavioral Health Center of Excellence. So really, really thrilled about this Center of Excellence. I believe Director Claudia Powell is with us today. Hi, Claudia. Thank you so much for being here and for the amazing work you and your team are doing through the Center of Excellence. The thing that we're excited about is the Center of Excellence will really have the opportunity to work upon request. So a person or an organization can send in a request whether you're a grantee or not. So it could be any other community-based organization that wants to scale up or do more work or do some training of their staff or others related to working in the tribal behavioral health space. And so lots of different opportunities there. One goal of the Center of Excellence is really to strengthen the workforce. We know that it's so important that the workforce is poised and trained and ready to be able to work with tribal communities and others. And so that's one area of focus of the Center of Excellence. I love the name, 7 Generations. 7 Generations American Indian Alaska Native Behavioral Health Center of Excellence. And I love that, we talk about just the generational, the importance of sort of generational connection and passing wisdom and experiences, down through, generational lines. And so I think in many ways that's some of the, thinking around the 7 Generations naming. So the other thing I wanted to share is, one program that's coming up is it'll be an 18-month Leadership Academy that the 7 Generations COE will be having. It's for individuals, Native individuals, to include youth. It's designed to support early career efforts to build really the next generation of leaders in the tribal behavioral health space. And so really excited about that and looking forward to what I know is going to come out of that amazing convening. And the nice thing, 18 months allows for it's, we know sometimes shorter trainings can be valuable, but when you have an extended period of time, it does allow for, I think, real valuable experiences, sharing, learning, and really the taking in of important awarenesses that can be life-changing. I think sometimes longer experiences like that can be life-changing from a career shaping and even a personal perspective as well. So really pleased about that work that will be happening. The next thing I wanted to share about is, as I mentioned, we love the convenings because, again, it's an opportunity to bring folks together and to have sharing of ideas, practices, things that work, things that are not working, recommendations. We eat this stuff. We eat it up. And so I'm so grateful that every time we put these calls out, people do attend. And so we're grateful for that partnership. But earlier in the year, we convened a promoting prevention and healing through, it was essentially a summit, our first ever tribal recovery and prevention summit. And that was a wonderful opportunity to be able to, again, talk together in this space about what does prevention look like? When we say prevention, what do we really mean by prevention? When we say, indigenous practices and prevention, how can those two be incorporated in a way that makes a meaningful difference? And some of the themes that we heard throughout that meeting is that, culture, that it is so important for a person's identity and their development to be able to be connected to cultural beliefs and traditions and elders and language, and that is prevention. That when a person is centered and grounded in that, it can truly be a protective factor. We often talk about risks and protective factors, and certainly a theme throughout this meeting, also a theme when we did our Tribal Youth Summit, was that culture is healing and culture is prevention. And so it's helpful for us to hear that, and certainly for me and my team to hear that, because then as we're thinking about programs or funding or policy, then a message for us is that culture has to be centered in that, right? It has to be centered in a meaningful way. Things like language, that is so important for young folks and others to have opportunities to be able to connect with and learn their traditional native languages, and so to create, whenever possible, opportunities for people to have, for young folks and others to have opportunities to learn language, family, community engagement, that all of those areas are important. And so we're, again, just grateful for what came out of that Tribal Summit. So what I'm going to share with now is just, we'll talk about some of the work that's happening at the grantee level. And again, I have felt so honored and really blessed to be able to visit so many grantees across the country in rural areas and more urban areas that are implementing some of our grant programs in ways that are culturally congruent and meeting the worldview, beliefs, and values of individuals that they're entrusted to serve through that program. I'll talk about 5 programs, and so one, you heard me mention already, our tribal behavioral, or our TOR program. It's our Tribal Opioid Response Program. It's our largest grant for tribal communities around addressing the opioid and overdose epidemic. It funds a broad range of prevention, treatment, and recovery services and supports. I'll also talk about Circles of Care, talk about Project Aware, our Garrett Lee Smith initiative, and I'll share a little bit more about each of these, but then also Native Connections and some of the amazing work that's happening through each of these. Those 2 pictures, those were from visits we were able to do with the Lummi Nation and also the Squinomish. We were able to visit their health centers that were funded by IHS. But then each of them had different constellations of SAMHSA grants as well. So the Lummi Nation was able to visit the site where they're implementing the TOR grant and able to sort of witness some of the really important work that they're doing there. And in fact, on one of the visits, what I will share is we were able to go into it was an encampment area where individuals funded through TOR were disseminating naloxone there in the encampment area. So just it's been so helpful to see. We often talk about the work it's so important when we're truly meeting individuals and communities where they're at. And so to be able to go with them to the encampment and disseminate sandwiches or naloxone or even information about when the next group is being held for individuals who are living in this encampment area was really impactful. So in terms of TOR, some of what we're seeing, and again, this is the grant to address the opioid epidemic. We have grantees all across the country implementing the TOR grant. So this is a tribal-only grant, implementing it for tribal communities. And what we're seeing is there has been uptake, that there's quite a bit of traditional practices and culture that's been incorporated into the grant. So we love that, and we're hoping that continues. We certainly are going to continue to highlight that. Folks know almost wherever I go, I will mention that we've incorporated that in our NOFOs, that culture, please incorporate cultural practices and traditions and help us get the word out when these grants are out so that people know they're available. But for example, in Oklahoma, we're seeing the Choctaw Nation use ancestral stories from the Trail of Tears, really to exemplify strength and resilience and movement through struggle and movement through great trauma, and just the power and the importance of being able to share those stories, sometimes across generations, but to help give people strength, through their struggles. So that's one thing that we're seeing there. Through in other examples, the Cherokee Nation, we're seeing sweat lodge, so regular sweat lodge ceremonies. And so it's been wonderful to hear about that. Within the United Kiowa Band of Cherokee, incorporation of stickball into communities as sort of an ongoing way to bring people together. In a cultural practice that has meaning, that again brings people together. And we know sometimes we say that culture is healing, but also community is healing, right? That people sort of heal together, and through the binds and the ties that connect them within a community or within a family. And then the last one, the Feather River Tribal Health Center, they're having just a whole range of monthly and regular cultural activities. So we see things like beading or dance or song, and all of that I think makes a difference, particularly for young people, but certainly for others as well. So wonderful to see, and I so applaud the grantees that are working on these programs. The next grant I wanted to talk about real quickly is our Circles of Care grant. So Circles of Care is a wonderful grant. It's a grant that helps with infrastructure building. It helps with being able to assist tribal communities in developing an infrastructure, obtaining resources to improve really a broad range, mental health, substance use related areas for children, youth, and families. It's pretty broad, almost by design, because we really wanted communities to be able to propose what they need, to propose what's meaningful for them, to meet the needs that are most salient within the community. And so this is also one of our tribal-only grants. And what we see is, again, it's an opportunity to bring young people together. We see quite a bit of things like plant medicine, beading, sewing, storytelling, and I was able to visit it's actually the next grant. It's a Native Connections, but again, what we see is young people coming together and others sharing in these practices. It connects them ultimately with their with culture, and that often is healing. The next grant I'll talk about is Project Aware. And Project Aware stands for Advancing Awareness and Resiliency in Education. I love this grant. This is, I love all of our grants, but but this one is a wonderful grant because it is a grant that is housed within schools. It sits within school-based settings, and it allows schools to develop sustainable infrastructure around helping to identify young folks that may be struggling and ultimately to connect them with supports and any needed services or programs. And so, I was able to visit several different sort of Project Aware grantees across the country and love the ways in which, again, the resources are being used in a meaningful way to address the needs of young folks. I visited one actually it was a Saginaw Chippewa tribe up in Michigan, and actually the First Lady attended that one as well. And in one of the classrooms, it was just wonderful. In one of the classrooms, there was a structure. It looked like, I'm sure there's a name for it, and I apologize, I don't have the exact name for it, but it was a stick-like structure. It was a dome. It almost looked like a sweat lodge without the covering on it. But it was there in the classroom, and it was for young folks to be able to self-select when they wanted to go and just have a pause, to have a minute, to sort of reflect or think. And it was wonderful to see that there in the classroom. I think the students helped to build it as well. And so really appreciate just the creative ways in which the resources are being used. Another example in South Dakota, the Little Wound School Board is using some of the Project Aware resources to fund Canoe Journey. And we know, had the opportunity to visit in the state of Washington a traveling exhibit around just the importance and significance of Canoe Journey and the ways in which, particularly for young folks that are sort of in a place where identity is something they're sort of thinking about in terms of adulthood and transitioning to adulthood, but also family and community and connection and wellness, all the ways in which from a layered perspective and even a generational perspective, Canoe Journey can be helpful. So it was wonderful to see, for one, that exhibit, but also to see that this is being incorporated within the Project Aware grant. Also, the Saginaw Chippewa tribe in Michigan is incorporating the Ojibwe language within the school. So again, and I hope I said that right, but that may not be the exact pronunciation, but essentially incorporating traditional language into the school and learning, and how important that is from young folks as well. And then the Two Feathers Native American Family Services, Project Venture, they're implementing, which is a Native curriculum around sort of teaching young folks traditional values. I'm going to continue on, because I did say I wanted to leave time for discussion. So I'm going to look through these last few a little bit more quickly. So Garrett Lee Smith, this grant is really important because it is a school-based program. Often it can happen at the community level. There's a school-based version of it as well. It's essentially around sort of suicide prevention, helping to raise awareness around suicide sort of resources, providing training for school personnel and others to be able to identify young people that are struggling. It's a whole range of possible projects that can be proposed. Two that I'll share is the Aleutian Perbolif Island Association, that they essentially are implementing a Breaking Waves initiative and program. And the wonderful thing about that is it teaches life skills. It teaches life skills along with traditional skills to help young people, through their, just navigate their journey. It also teaches cultural traditions, and quite a bit of work related to and experiences related to kayaking. So being in the water with the kayak in community, and just the wealth of sort of health and culture and healing that can bring for young folks. And then you have one more example, the Winnebago tribe has annual mental health powwow. And we know how important that can be, just coming together to raise awareness around mental health. I'm going to end with the Native Connections grant, and was able to visit a Native Connection grantee in Alaska, and they talked about how through the pandemic, the young folks said that this program was life-saving for them, literally life-saving. That it was hard to be to do the isolation and to be so apart from each other. But through Native Connections, they were able to come together through the Alaska Heritage Center and to do things like beading or share stories or traditional song or traditional dance. Right around the time we visited, I think it was a week before, there was a meeting that brought many of the Native Connection grantees together. And so I'm going to share a video that is the outgrowth of that meeting. It's real quick, and then we'll have time for discussion. But the thing I love about the video is the young folks really talk about sort of culture and what they need, what healing looks like for them, what culture looks like for them. And so anytime we can get this, it's truly a gift in terms of the work that we're looking to do. I think, I'm not quite sure how I play the video. Can you guys play the video? There's a link on the screen. Oh, they don't have it. We'll get there. It's really short, but it's if not, I'll make sure we send it out to everyone, but I think we can, if we're connected to awesome. Thank you. Let's see if we can, sometimes the sound doesn't share. I think we have to share this. I think there's a way to share it and share sound as well. Oh, we don't have sound? Oh, okay. Oh, that's an important part of it. All right, so we'll make sure everyone gets this. We know how to find folks, but we'll make sure you send this out so you can watch it, because it really is. I mean, the young folks do such an amazing job just sort of outlining what they need, what they're experiencing, what's going to make a difference, what they need. But maybe you can watch it then. So they did a lot of breakout. It brought the entire cohort of grantees together, and they had breakout sessions where they talked about sort of what they need. You'd see the different questions, their vision for the future. They're talking about wanting more outdoor activities, more kayaking, dance, cultural practices, celebrations, more housing programs, food. So many different areas. Supportive services, natural medicines, many of the things that we're talking about. Oh, thank you. Thank you. Thank you. Thanks for finding the sound. And we'll make sure that you have a copy of it so you can see the rest of it with sound too. You know, the young folks are just such leaders already, right, in their own right, and such change makers. So we just feel it's such a gift whenever we're able to be in connection with them for a period of time. And so I believe that was my last slide. I'll stop there. And again, Native Connections, it's a tribal-only grant program. We have grantees all over the country that are doing really creative work with that. But again, appreciated being able to have the opportunity to share about some of our programs. And again, thank you to everyone who's here, especially those who traveled in. I know some folks had some late night / early mornings getting here, but we're just so grateful for your partnership, for your voice, for your vision, for sort of, I can certainly say in my role as Assistant Secretary the last almost 4 years, it has been a pleasure to connect with so many of you in different arenas and avenues. And I look forward to hearing about the ways in which I know this important work and these important collaborations are going to continue. And so with that, I'll stop and happy to take any questions that folks may have. Yes.
So I guess I'll just ask, in the time that you've been working with, what's the most creative way that you've been able to support that? Is there any way that you were able to maybe reduce some of the grant requirements and reporting to make it more culturally appropriate and program friendly?
Yeah, thank you for that. Yeah, so I think everyone might have heard the question. So like, what are the ways that we're working to really support tribal applications and make the grants more friendly? We've truly been grappling with that. We've been working with that because early on after I started, I heard that, you know, our grants, they're a deterrent. They're a deterrent because they're too complicated to apply for. The data reporting is complicated, and so if you're just trying to keep the program going, to have to do this data collection, which is onerous, we were hearing it can take up to 55 minutes or more in some instances to collect data on some of the people that may be receiving services. And for someone that's not feeling well to have to go through a 55-minute survey it's a challenge as well. So what we've done is we're working on streamlining the data collection. We've gotten it down to 30 minutes or less, and so that was a goal, 30 minutes or less. And then another goal was to have, we're looking at the schedule at which that data has to be collected, and looking to add some tweaks there as well. We're also looking to, we're part of a pilot that was really across HHS to simplify and to really streamline the application process itself, to make applying for a grant a little bit more straightforward. And trust me when I tell you, I remember in my role as commissioner in the state of Connecticut, it's complicated to apply for the grants. I remember several of them where we missed the deadline. We're at 5 o'clock, we're still working on it, but we remember there's at least one more post office in New York City that if we can finish up this last part, we can drive it up to New York City, but that's too much. And so we are working to also streamline the grant application process so that is more straightforward. We've also had conversations. We have this one initiative, we call it Elevate CBOs, so Elevate Community-Based Organizations or tribal community organizations. And so the goal of that work is sort of working with community groups and others around applying for grants. You know, what are some things to think about when applying for a grant, or developing the budget, or reporting the data. And so those are some of the other things that are under discussion. And then the last thing I'll add, we have had some discussion even around, you know, what about narrative data collection? You know, is that an option? And so that is certainly something that we heard that multiple times, and that one's a little bit more complicated. But we're sort of looking at different types of ways to collect data and different evaluations. So maybe some of the narrative work can be done on a specific evaluation of a program, but not necessarily for all of the programs. So stay tuned. We're really trying to grapple with both of those to make the grants more accessible, to include things like changing the timeline from 2 to 5 years, things like that. So I hope that got at your question.
Maybe I could just make a comment with that,
Yeah.
So we do a lot of data collection. We probably have one of the most amazing data collections, way that we do that, our primary care system. But what we found is that you can ask all the typical questions, gather the data, but probably some of the most informative information you get is out of that short narrative that they might share. And so I would think with grants, you might get some very valuable information in that manner rather than the check the box questions that you might ask.
Yeah, you're right. I mean, as a qualitative researcher in a previous life, really mixed methods, but I loved the qualitative part because that is where you get a lot of it's where you get the, I don't know, I feel like just the heart, you really get at people's experiences through the qualitative. But, through Congress, we are required to report other data. Congress wants to know, like, what is happening with our funds and resources in specific ways. So some of the data that we collect is data that we're required to collect through Congress, but we're trying to minimize that as much as possible and not have anything else extra in there if it's not meaningful. And then the other thing we're looking to do is we want to create more feedback loops with the data. We just don't want it unidirectional with the data. And so there's been discussions among the team, and I know this work will continue as well, around how we can create opportunities for people to be able to access their data. In fact, the DepSec mentioned that this morning in terms of the data strategy and data initiative, but also ways we can feed back data and share data, related to some of the grants and things. So, any other questions or comments? Right. All right. Well, thank you so much, everyone. Appreciate the opportunity to share about our programs and initiatives. And I'll be in and out over the next 2 days, so look forward to continuing to connect with everyone. So thank you.
Thank you again, Dr. Delphin Rittman, for the incredible work that you're doing over at SAMHSA. Certainly, firsthand, I can tell you that the programs are working, especially at Native Connections and Circles of Care, where my team is working out in the tribal community, so we appreciate the opportunity to do that. I believe all of us here, and you will hear it over and over again, culture as prevention, culture as a way for us to be able to practice some of our traditional healing, culture as a way for us to remain grounded in who we are and help with our identity and our esteem, and how important that is for our youth as protective factors. When I was at ANA, certainly we used language. We saw that even though it was considered a native language program, we really saw it across the spectrum and how it impacted all of our social service programs, how it impacted education, how it impacted leadership abilities, how it impacted identity. That language wasn't just about learning our native languages, but it was about really reinforcing and reinstilling who we are as Native peoples. And so I love seeing that it's now being promoted and supported across the federal agency of HHS, and we'll continue to do that. And it's because of folks like you in this room who are giving those examples, who are doing the work already without permission and demonstrating how culture, native language, really contribute to who we are, not just as Native peoples, but to our health and to our success in our communities. So thank you for that. We're now going to take a break. We're going to break until 2 o'clock, and at that time, we will have our next panel. So if we can ask everyone to come back to their seats by 1:55, that would be great. If you need to run upstairs, the penthouse is still open. The restrooms, again, are back by the elevators, and for our ladies' restroom, I think they're still working on it. You can feel free to just follow this wall and the signage back here. We'll see you back at 1:55.
Produced by the U.S. Department of Health and Human Services.